keeping the memory of Dr. Nitu Mandke alive. We are again gathered here with a stellar collection of personalities, not only from the field of medicine and surgery, like most of you are, but also from the field of arts. So we are growing bigger, better, and brighter. Thank you, ma'am, for being with us here and adding that sparkle that I am sure this gathering needs. Talking about spark and sparkle, we're going to start with lighting of the traditional lamp, and for that I'd like to request the gentleman who are going to sit on the dais and Dr. Mandke to please step forward and start the lighting of the traditional lamp. May I request our orator to please step forward, sir, Dr. Attawar, to please step forward to the lamp. Our special guest, Mr. Nalini, of course, Dr. Jamshed, who's our coordinator, our chairperson, Dr. Mandke, Dr. Suresh Rao, can you please step up, sir? And gentlemen, many of the ladies and gentlemen whose names I'm not very familiar with, I request you please step forward and help with the lamp lighting. And we have the
वन साइड लेना है सबको, उस साइड लेंगे सबको, तो फोटो आ जाएगा, ये भी आ जाएगा। इनको हाँ ले, इनको बोलो हाँ।
Comes the moment, comes the night always. Thank you, Madam.
Sir, please go. Thank you, sir. Sir, just on this side. Yeah, okay, fine. Just
May we have a photograph, please? I request our photography director to please
just to gather one picture group.
Perfect photograph.
Sir.
So this is a Kodak moment, ladies and gentlemen.
Sir, just close. It's a bit close, sir. Just close, sir. Yeah. Yeah, fine. Just look at the. Yeah. Yeah, you can. Some more. Yeah, madam, yeah, camera. Okay. Yeah.
Kind of smile. Nowadays, if you use terms like Kodak, people know how ancient you are. People should say now, it's Instagram a good moment, right? Thank you very much. Talking about moments, the moment that people waiting for has arrived. Please take your seats, ladies and gentlemen. Our orator brings a wealth of experience and lots of innovations in his approach to cardiac health. And he's going to tell you about some very interesting things. He's going to talk about cardiac health, and whether it's a science or an art, you'll see that his science is an art. But to talk to you about him, I'm going to request a gentleman to step up on stage who needs no introduction to any one of you. He's, the type of people that 90% of the people in the world will envy. Starting off when he was young, he'd be a brilliant student, and then he went on to be a brilliant professional in his career. He started off with being the Young Achiever. He's got the Young Achiever Award, being the best in cardiology at the Cardiology TM. Many awards and recognitions over the years, and he is instrumental in starting the cardiac centers, and name any big hospital that you can, including DLRG, here, Koki Label, Fortis, Lockhart. He's the man. Without further ado, you know him as the Director of Cardiac Sciences, but most importantly, he's a man who carries his, demeanor with great poise in his hand. Ladies and gentlemen, please welcome Dr. Jamshed to introduce the audience.
Thank you very much. I quite didn't recognize myself when you were talking about me. I have a great honor and pleasure to introduce Dr. Sandeep Attawar. Many of you may not know him. He's the chairman and director of thoracic organ transplants, assist devices at the KIMS Institute of Heart and Lung Transplantation.
He's also the current president of the Indian Society of Heart and Lung Transplant. He was actually born and brought up in Ahmedabad. I didn't know that. And did his medical school at the Sheth KM School of PG Medicine. He further specialized in cardiac surgery at the Citation Hospital, of course all you know, very famous hospital in Trivandrum. He subsequently worked at the Manipal Heart Foundation and the Narayan Hridaylaya, again brilliant big hospitals all over India, very famous. So he had all his basic training, I think, in many of these institutes. In 2001, he specializes in setting up greenfield heart surgical services. And he expanded all his skill towards developing thoracic organ transplantation and circulatory support. So he now focuses on top-down realignment of pre-existing cardiac and respiratory services. That's his words. So what he does, he takes a small little place which is doing a little bit of work in cardiology, and then he converts it into a heart-lung transplant center. And so he goes from place to place and tries forming these heart-lung transplant centers. And I think it's very important to understand that, because I think the final end of the need after you've done all the angioplasties and the bypass surgeries, that you eventually are likely to need a transplant. I think that's where we were a little backward some time back, but I think with people like Dr. Attawar there, we are now coming to the forefront of heart transplants and heart-lung transplants. So we are very grateful to him for having brought this field so much advanced into our country. So that's what he's doing, and he's done that all over in Hyderabad, Bangalore, Pune, even Mumbai, Chennai, Delhi. So that's what he's been doing over the last 5 years, setting up heart-lung transplants all over the country. And as you know, when we had COVID, we had a lot of lung problems, and many of these people had severe lung damages, and were told that, well, sorry, you had COVID, your lungs gone, you can't do anything. But there he came in out there, and he's done 30 successful double lung transplants for these COVID patients. So I think he needs a hand for that. Tremendous work in terms of this very sick and a new disease, of course, which came in, and he seems to have found a solution for that. Now, don't be shocked. He has performed 700 plus thoracic organ transplants, 513 double lung transplants, 129 heart transplants, and 58 combined heart and lung transplants. I wouldn't believe it when I read it. So that's an amazing feat. I think most of us don't even know whether heart-lung transplants are done in India, and you have this huge number of patients being done, and we seem to know so little about it. So I think one of the things, I call all my residents and I said, you must come. I don't know much about heart-lung transplants in India. You better start learning right now. So he's on the international panel, of course, as expected, 24 experts to form the consensus guidelines. And these guidelines have, of course, become lung transplant Bible. So everybody follows these guidelines formed by these 24 brilliant experts. He's also a contributor and made of a textbook called the Transplantations and Mechanical Circulatory Support for End-Stage Lung and Heart Disease. He has pioneered the first breathing lung transplant perfusion. I have no idea what it is, but I hope he tells us about what it is. So this supports the end-stage lung and heart disease patients. He has pioneered he has worked and published, of course, in leading journals, that's well to be expected, Annals of Thoracic Surgery, and very many other very important journals of heart and lung transplantation all over the world. He's a scientific advisor for Reliant Heart and involved in advancing field of mechanical assisted circulation, long-term ventricular assist devices. For those who don't know, these LVAD devices are something which are mechanical, which continue to make the patient live. So you actually have a bionic mechanical heart in case your heart fails. And then, of course, that may not be long-lasting, and therefore you need to go for transplants. And I think that he would be able to explain to us much better about the LVADs versus the transplants and what may be the advantages of the other. He's, of course, being such an expert, he's a proctor, goes to many places and talks about these devices. They're called the HeartMed 2, the Javik heart. These are all sorts of devices, mechanical heart, as we call mechanical heart, to keep the patient alive. He's of course a firm believer in universal access to quality care and outcomes. I think that's very important, because when you talk of heart-lung transplant, and if you ever tell a patient, even the rich patient, they immediately say no. First of all, they're worried that it'll be too expensive. Secondly, they're worried that they'll die during transplant. In fact, any patient I would talk to who doesn't know much about transplants, their first reaction will be, no doctor, I don't want to die that way, I'll die this way. But they don't know how much successful the process is. And I think that's what we need to go away today learning, that this is not something which is done as a desperate last bid. If it's well, fine. If not, sorry. No, it's an ongoing treatment which is extremely effective. And I think we need to learn that and talk to each other and explain to people that lung transplant, heart-lung transplants are done in India, are done successfully in India. And I think that should be the takeaway message from everybody out here. So, of course, Dr. Attawar is an active member of International Thoracic Forum's Society of Artificial Organs, American Society of Transplantation. So, great pleasure to introduce you, and I'm sure we'll all go away learning more. I'll certainly learn, and I'm sure everybody else will. So, please, Dr. Attawar.
Again, Dr. Attawar starts his oration and the CEO of Thank you.
Good evening, ladies and gentlemen, dignitaries, Dr. Dalal. Ma'am, I'm deeply honored. I'm very touched. This is a exceptionally generous introduction. I have no words. I'm going to now probably jumble and mumble up my presentation, but I'll try to start and see how best I can probably perform outside the theater. So what can I say about Dr. Mandke? I mean, I think everything that I could find about him, everything that I know about him is here. But it's my great honor and singular pleasure to pay homage and celebrate the life of an intrepid and inspiring physician. So I'm here on the Aegis, and it's a privilege for me to speak on his birthday. I would like to express my thanks to Madam Dr. Alka Mandke and the Foundation for this honor. For a surgeon who excelled in his profession, it's not just surprising to us, and it's especially to me, that his flair also came from his love for the arts and its appreciation. And the question is, did this additional quality give him the edge? And I think I'll try to explore this in this presentation and try to take a deep dive as to how art meets science in surgery. So this picture in this caption shows Dr. Christian Barnard, many of you must have heard about. He performed the first heart transplantation in South Africa at Groote Schuur Hospital in Cape Town in 1967. I wasn't born then. The procedure was very novel because it marked the culmination of many cutting-edge experiments in assisted circulation, animal experimentation, and also surgical refinement of many surgical techniques. And I'd like to use this picture, and I want you to hold this image for a while so that we can know as to how we got here and what changed after we got to this moment in 1967. So coming back once again to, is surgery art or science? The question has many layers. It has many layers because it's a complex question, and just like you're looking at a musical composition or you're looking at characters in a drama or a play, they're all interwoven with each other in inseparable ways. You know, at the end of it, you always recollect and remember a memorable story. You can look at art in the similar fashion as it continues to evolve in the hand of a master artist. So in many ways, I find my own personal journey in art in many ways. It led me to self-realization, and I can assure you, as Sir described, it's a spectacular ride, and I wish that I can continue to share my experience with the younger generation of physicians who probably can take the field forward, which I know they will. So I am a thoracic transplant surgeon, a professional one. I don't do anything else except transplantation. I am the director of the program based out of Hyderabad. While we have affiliate centers and it's a hub and spoke model, we work with and partner with hospitals who have the similar ambition. The idea is to probably make transplantation more accessible. Our country does not have as many donations as we wish we should have, but we have at least 10 to 20x number of patients who are suffering from end-stage heart and lung disease. and most of them suffer in insufferable existence in the presence of disease. And as I can see in hospitals like ours, we'll see them walk in and around the corridors with oxygen dependent, multiple admissions to hospital with heart failure. Very sad and pathetic. So when I treat some of these medically intractable end-stage heart and lung diseases, I truly believe that the only recourse to them with a good life is probably an organ transplant. We can get back to health, get back to wellness. But right from my early childhood, I was deeply interested in the arts, music, architecture, and the appreciation of all of them. And these passions come from my mother's love for vocal music, my school building where I studied, which was a blend of Jesuit architecture. I studied in St. Xavier's in Ahmedabad, Jesuit architecture with a lot of Indian and Gothic influence. And during my travels to and from school and home, I used to pass by some UNESCO World Heritage sites in Ahmedabad. Many of you have visited Ahmedabad. You can see some of them here. There is the Badra Fort. There is the Sidi Sayyid Jali. That's my school. Then you have the masjid, the Jama Masjid. And also, I've put a picture of the Sept School of Architecture. I'll tell you why. So we come from an age where when we were good at studies in school, parents thought that probably engineering or medicine was the only option. We did not have any other option. And my father told me once that if you do anything else, you will be considered a failure in life. So I was actually very torn between my love for singing and my desire to be an architect. And both of them were my real passions. While I continued to excel in school because, there's always the fear of, being a wastrel if you did not do well. And I distinctly remember that there was a very low entry barrier for admission into the Sept School of Architecture in Ahmedabad. I think they told me 52% marks in 12th standard. And I was so excited. I said, "Ye to mil hi jayega." But my dad had other plans. And I still believe that I probably would have been a better architect and I definitely would have been a better musician. But that's all passé now. I mean, there's a lot of water that's flown under the bridge. I can only reminisce, but I think I've done a fairly decent job of whatever I picked up. So I made a final attempt in my 12th grade to pursue my architectural instincts, but I buckled to my parents' will. So medicine became now my stage, and eventually surgery became my drawing board. But to keep both of them separate, surgery has always, when we got into medicine, surgery was always defined as a science, and nobody ever described it as an art. And that was the impression when I got into my training in surgery. So I'll kind of briefly step away slightly, and I'll tell you a little bit about my understanding of music, because it brought a new layer into how I realized myself. Because I believe that every musical performance has a collection of notes that are all strung together harmonically. You have various melodies, you have various textures that are brought in, and then you have all these background voices, and you have these musical accompaniments, and all of them are beautifully brought together by the composer and the lyricist to form a conjunct melody which remains immemorable for all of us. And there's a structure, there's a musical phrase which is then introduced, and then it is modified, and it is inverted, and it's altered, and it's reimagined in every possible conceivable fashion. It's like almost like gymnastics with a musical phrase. And then it creates a journey where when you listen to a piece of music, you almost feel like you're traveling. It's like you're traveling, and then it brings you back to the same original phrase and the note, but in an altered chord, so that it becomes very memorable. So similarly, as physicians, we also use patients' emotions, we use their symptoms and their signs, and we try to make sense of all of it. And all the time we are trying to add some more information by utilizing investigations, analyzing them. And then when we have all of this together, as human beings, we are all accustomed to using Bayesian logic. The pastor Richard Bayes, who actually in England identified how Bayesian thinking works. So we use all our past memories, we recollect them, kind of catalog all of them and make better decisions. That's how we continue to improve. So similarly, a composer would keep adding notes and textures and alter the music as it goes forward. Likewise, as physicians, we diagnose, we identify the problem, we treat, and then we heal. So art and music, to me, and I'm sure I would like to impress this upon you, are the pinnacle of communication. since they deal with non-verbal expression, something that pleases the mind, something that engages the deeper sensibility and inner sensitivity in all of us. And then there are very important lessons that all of us learn from them. And these are invaluable because they help us communicate, they help us emote, and they also help us interact with one another in the practice of medicine. And I truly believe that this is appreciation of art that makes you a more caring and a more sensitive person, because you have to deal with the very sick, you have to deal with the ill and the frail, somebody who is very low on hope and very low on confidence. So if you consider all human accomplishments that have to be attained, it must be acknowledged that you need a lifetime of wholehearted effort, dedication, in order to reach any stage where you achieve significant results. And as it is true for an architect who designs an outstanding building or a structure, or for an artist who creates a masterpiece, or even for a surgeon who performs a very complex surgical procedure, like Dr. Rao would perform seriously complex operations in children with multiple heart defects. Surgeons must continually improve their execution, keeping in pace with the unremitting scientific advances and technological developments. And then melding all these lessons that we learn from not just art and from music, we are able to use medical science and precision medicine to make it a powerful force where we can have better care and greater outcomes. And this is a journey that every single physician in this room is compelled to take. Because we are healers, we will never see the end of it in our lifetime, but in the passage of time, as we see the results, it makes this journey more worthwhile, it makes it more compelling. So let me take another step back and try to tell you how we got here, because we are talking about the evolution of surgery in a quick, brief, probably 5 or 7 slides, through 2 millennia of documented history. And many of you would know that if you're looking at the ancient beginnings, surgery is considered a craft and a ritual. And you're looking at, you've all heard of the physician Sushruta. So he published a treatise called Sushruta Samhita. It's an ancient Sanskrit medical text, and it is foundational to Ayurveda. It was written by Acharya Sushruta, who was known as the father of surgery. It detailed comprehensive knowledge about anatomy, physiology, pediatrics, toxicology, and more importantly, it also described close to 120 surgical instruments, advanced procedures like even rhinoplasty, making it one of the most significant and oldest existing surgical textbooks. Strangely, you will notice I have a picture of it, which is an original one. It tells you it is in palm leaf. It's inscribed in palm leaf. And then when you look across cultures and civilizations, you'll notice that there exists evidence that even Egyptian surgeons performed a procedure called trepanation. It's a procedure with a neurosurgeon would tell you better. It's a small hole which is drilled or scraped into the skull, and it's used to treat head injuries. It's used to treat skull fractures or severe headaches. Because by relieving pressure on the brain, the procedure not just required someone to have exceptional skill, but even a small misstep could lead to death. A time when we had no scans, we had nothing at all. Why we know these were successful in their hands? Because there continue to remain, or they unearth remains from Egyptian tombs which show successful trepanation, which suggests that there is an evidence. When you look around it, forensic evidence tells you there is bone regrowth around the edges, around where they were drilled. And this tells us that these patients survived for many years after these procedures, and it is a testament to all those Egyptian physicians and surgeons 2,000 years ago who could do these procedures with skill and precision. Then as time went by, we came to the Middle Ages. I'm not going to talk about the Dark Ages because there's hardly anything evident as far as scientific research in the Dark Ages. So in the Middle Ages, surgery was generally performed by barbers. They were considered craftsmen. They were distinct from university-trained physicians, and they were the most common practitioners of surgery in medieval and Renaissance Europe, combining not just essential practical medical care like pulling tooths out, bloodletting, treating wounds, while academic physicians focused on medicine. So none of them had any formal experience or expertise or even training, so they learned through apprenticeship, just like an artist would learn in a master's workshop. They served soldiers during wartime. That's where they learned their craft. And their skills were crucial in certain areas where physicians would not touch or enter. And then as we went forward, we came to the age of enlightenment. That was the birth of scientific surgery, where this gentleman in the center of the picture is Ambroise Paré. He revolutionized surgery by not just championing practical, empirical methods in surgery over outdated theory, earning him the title of the father of modern surgery. And his contributions were shifted from using boiling oil to cauterize a wound, or for gunshot wounds for that matter. He was more in favor of a less painful ointment or a salve. He also introduced arterial ligature for wounds that were bleeding during amputations. He created artificial limbs. He improved surgical instruments like trephines that we saw in the Egyptian story, and documented treatments for head and skull and spine injuries. He even treated phantom limb pain, making surgery not just more humane but also more accessible. The 19th century saw the scientific revolution in surgery with the introduction of anesthesia and antisepsis. You had William Morton, who introduced chloroform for anesthesia, which led to pain-free surgery and better recovery. We also saw Joseph Lister introduce antisepsis to sterilize wounds, which drastically reduced infection rates, thereby establishing surgery as a scientific discipline. The 20th century saw the Davis-Bowie cautery, which is an improved electrosurgical unit. All of us use it in its modified form now. This was the 20th century, which is the age of innovation and specialization. And then as we went forward, we saw that there were transformative changes in surgery, driven by technological breakthroughs and the emergence of specialized fields that not just improved precision, but greater safety and better outcomes. Key innovations also turned out to be blood transfusions, the introduction of minimal invasive surgery, organ transplantation, to speak of some of them. While many specializations like neurosurgery, cardiothoracic surgery addressed complex anatomical challenges once we could stop the heart and fix a heart defect. Electrosurgery emerged in the early 1900s, enabling precise tissue cutting and coagulation. 1990s also brought in endoscopy, laparoscopy, thereby revolutionizing minimal invasive surgery with the first laparoscopic cholecystectomy done in 1985. So now when I peel back into something else, through some of the next slides, I would like to try to convey to you in some meaningful fashion why art and science will work together to create something which is bigger than a sum of its parts. So in many ways, these are both mutually reinforcing, and they're intertwined like a cable or a cord, intertwined in ways that, or braid, the braid that women use and hairdo, in uplifting and the practice of surgery and medicine at large. So I want to tell you why surgery is a portmanteau or a fusion of both art and science. Science is grounded in anatomy, physiology, and evidence-based practice, whereas art requires creativity, intuition, and adaptability in an operating room. Surgery blends both precision, that is science, and finesse, that is an art. I cannot remember when I saw this, which year I saw this, but it always stayed in my memory. And in my frequent trips abroad to museum and art exhibits, I chanced to witness this bronze exhibit in Scotland. So this was created by a chap called Brian Kelly, who was a heart transplant recipient, and his wife was a visual artist. She was a sculptor. So they collaborated to create this striking bronze work. It's exhibited in Aberdeen in Scotland. The mission of this story was largely to positively impact organ donation and voluntary signing, which we call opt-in, in Scotland and United States, in United Kingdom. It's a small country, very minimum donors, and thereby there were many patients who were waiting for organ transplants, dying on the organ transplant wait list. So it's a very telling image of someone, probably reminds us of Hanuman, if I may say, in some ways. So for a very quick run through how organ transplantation evolved. It all started in the early 1900s with Professor Alexis Carrel. He was French by nature, by origin. He pursued a career in surgery in Chicago. He pioneered the vascular anastomosis that all of us do with elan nowadays. In 1905, he pioneered the implantation of a dog heart in another dog's neck, and he showed that it worked. He received the Nobel Prize in Medicine in 1912. He also worked with Charles Lindbergh. If some of you know, he's the first person on the surface of the earth to do a transatlantic flight without landing. So Charles Lindbergh was a philanthropist and an industrialist and a multimillionaire. He invested in the invention or the research for a CPB machine. That's where cardiopulmonary bypass machine, working with Alexis Carrel. In 1954, Dr. Joseph Murray in Boston performed the first successful renal transplant. The donor was an identical twin of the recipient, an identical twin, and it worked beautifully. That got him the Nobel Prize of Medicine in 1990. Then you had Dr. James Hardy in the University of Mississippi. He did the first human xenograft organ transplant, where the donor was a chimp. The patient obviously did not survive. We had a surgeon in the eastern part of our country who did a similar operation, and he was put in jail. He was banished forever. It created a lot of hue and cry in the press. It talked about ethics and so on and so forth, but it was looked at, probably the only option for patients with end-stage heart failure. And though the patient did not survive, obviously, because of, between chimps and us, I think we have close to 10 to 15 millions of evolutionary bridge. So that genuinely did not work. However, it opened up the passage or the pathway to the world's first heart transplant in 1967. That takes me back to slide 1. The donor in this picture in the right lower hand extreme corner is a lady called Denise Darnell. She donated her organ to a chap who was, I think he was a plumber or a technician. His name was Louis Washnowski. He was a big-sized male. This was a small female. Clearly, in scientific understanding, it was a mismatch. However, what is most remarkable is this was a circulatory death donor. That means the heart had stopped. The surgeons were so capable enough that they picked up a heart from that donor and they could transplant it, and this patient survived for 19 days. In an era where we did not have immune suppression, that is, we did not have anti-rejection drugs. The only therapy we had that time was prednisolone, which is a steroid. This recipient, while the operation was successful, he survived for 19 days. Sadly, he passed away because of a pneumonia. So this became an absolute sensation because there was a race between the US and Europe as to who would do the first heart transplant. What is strange is Dr. Christian Barnard was just an observer in Michigan, where he observed some greater surgeons who had been working in this field for a long, long time, experimenting on dogs. I'll speak about them a little later. But he became a superstar. All his girlfriends were from Hollywood. Then the next year saw many centers across the world perform heart transplants successfully. After Christian Barnard, who's in the extreme left-hand corner, we saw Stanford Medical Center and Dr. Naumann Shamwe, who's considered the father of heart transplantation because he's the person who set the basic understanding and the research as far as heart transplantation was concerned. He continued to do successful heart transplants at the Stanford Medical Center in California. His associate, Richard Lauer, was based out of Richmond at Virginia Medical Center. He successfully established a transplant program in North America. And across the Atlantic in Europe, at the Petit-Salpêtrière Hospital in Paris, we had Dr. Christian Cabral, who performed successful heart transplants. And then came a time where, after all these, as you can see, some timestamps, there came an era of disenchantment, where between these years, I'm sorry, I skipped a slide, let me go back. So there came a time where 102 heart transplants were performed across 17 countries at 52 medical centers with a median survival of just 1 month. We now have, just to give you some perspective, we now have a median survival of between 8 to 10 years after a heart transplant. That means 50% of patients who undergo heart transplant would survive for 8 to 10 years in the modern era, sometimes even longer. But this was a time when they survived only 30 days. 50% of them did not cross the 30-day barrier, but surgeons and physicians continued to innovate and continued to push the boundaries. In the year 69, only 50 heart transplants were performed, and between 70 to 75, fewer than 20 heart transplants were performed across the world. Most of them were at Stanford, or they were probably under Richard Lauer in Virginia. And the question was why? So we call this an era of disenchantment, a belief that transplants would not work. And that was largely because most of these patients died because of rejection. And some of them had infections because of overdose of steroids. And there came a miraculous drug called cyclosporin. It was researched by Jean Borel, who was a French-Swiss pharmacist who worked for a company called Sandoz. They discovered this medicine from a fungus, which was brought in by a sample from Norway. by somebody who was just going around the world trying to pick up samples to develop new vaccines and new medications. But the strange historical twist here is that, and a paradox is that, this life-saving drug, while it was manufactured and researched by Sandoz, which is a Swiss company, they were also a multinational that was deeply involved with the Nazi Third Reich in Germany. And they were involved in medical experimentation on inmates in death camps. They used prisoners as manual labor in drug manufacturing. And they were also at the forefront of inventing a drug called LSD, which many of you have heard of, which was considered truth serum in those days. And it was utilized for interrogation of prisoners by the Gestapo. So, a company that did so much good in medicine also has a dark history and a dark past. The introduction of cyclosporin, and this is Stanford's seminal paper, it came up in Transplantation Proceedings in 1990, much later published, but it showed the survival and renal function in patients in the pre and the post-SAND immune era. SAND immune is again cyclosporin. So you can see that this drug revolutionized medicine. There were a couple of other things that happened. There was a Scottish surgeon called Philip Caves. He invented something called a cardiac bioptome. You go in with a solid metal device like a forceps, go in through the internal jugular vein, take a small bit of the right ventricle, look at it under the microscope and find out whether you have rejection. So that allowed us to monitor patients better. There's a lady called Billingham, Margaret Billingham out of Stanford. She identified the grading system for rejection. So that was another great contribution. So there were many people that contributed to the resurrection of transplantation. And some of them are not mentioned in these slides, but I thought I'll bring them up to you. This led to an era where, with transplantation now getting a shot in the arm with the introduction of immune suppression, Dr. Bruce Reitz in 1984 performed the world's first successful heart double lung transplant in 1981. This opened up the era for lung transplantation, which unfortunately is not that common simply because this is the only organ which has a dual challenge. It is not just exposed to every bacteria, virus in the environment with every breath that you take in a transplanted lung, but it is also exposed to the hostile environment of a recipient's circulation. So both these environments try to kill that lung, identify the lung, and it's a great challenge so while I do not think that the surgeons do an exceptionally good job with surgery, I think the true challenge lies in pulmonologists and transplant physicians to be able to keep these patients alive and well after a transplant. That is probably the key to success. So when you look at all of this, I'll just take... What lessons do we learn? And how can we draw inspiration? So I would like to speak a few words about surgical apprenticeship, because surgery is purely not an intellectual, it's also not purely a technical exercise, it's also intellectual. The artist and the surgeon's technique has to be immaculate to accurately express what is in the mind. So when we speak about training that we go through, not unlike the surgical resident who spends years in the hospital learning various aspects of surgery from a senior or a mentor, and the art of surgery, while he successfully climbs the steps with increased responsibility, the art of a musical apprentice who also lives in a workshop in close contact with the mentor, absorbing day by day the talent and the skill of the master. The apprentice in a master's workshop will first make a paintbrush, he will then mix the paint and the colors, and he'll create the palette, paint a minor detail in that master painting which the master recreates in the end, until he reaches the opportunity where he can paint his own picture. The progression of a surgeon likewise is similar, because after a number of years of training, he finally reaches the professional independence for him to be able to perform that same surgery with the skill and the deftness of his master or trainee on some of his patients. So when we try to unify, assimilate, like a braid, consolidate, coalesce all these lessons, I think mentorship, art, surgery and science, they all meld together in the hands of a surgeon. And I like to bring this painting up in my last concluding few slides. So the art of surgery is beautifully exemplified in this picture. It's in Columbia Medical School, in the art exhibit of Columbia Medical School. It is a sketch by Ambroise Paré, whom we visited a few slides earlier. It shows methods of not just treating dislocation, but amputation using a ligature, and also how It brings forth the fact that intuition is something we learn in high pressure situations. That's how we deal with unexpected complications. We use techniques to tailor individual patient's anatomy, and then we also use human touch to not just express empathy, but also communicate with our patients. I'd like to bring up Michelangelo. This is a very famous sculpture which most of you would have recognized. It's an Italian Renaissance sculpture. It was created in the early 16th century by Michelangelo, the very famous Italian master. It is made of marble, the Carrara marble that you see in some of our buildings. That is the substance which it is made from. It's a colossal 5-meter statue. And it was the only statue from the Renaissance between then and classical antiquity. So that's very strange, nearly a gap of 1500 years. This marble sculpture of David, whom you know, is somebody who is considered as the founder of the Israel nation. He's a shepherd who killed the giant, who was a Philistine, and you know that David-Goliath story. So this was commissioned as one of those 12 statues of prophets from the Christian mythology that were supposed to be on the roof line of the Florence Cathedral. But strangely, it was so popular that it was kept in the square, which is called the Palazzo della Signora. If any of you visit, you will probably see it in Florence. And lastly, another thing that we must consider is that natural talent, dedication, and teaching, even if self-taught, they are not sufficient to carry one to the height of mastery. Fundamental to any individual's progress is the relationship with his teacher and mentor, and the influence of the school that he's trained in. We all stand on the shoulders of giants, that is to paraphrase Isaac Newton, and we can only see farther because they allow us to. So how do we elaborate concisely what does science do in surgery? There are advances in medicine that are brought about by imaging, robotics, minimal invasive techniques, evidence-based medicine, which is protocols for sustained and controlled outcomes, and in transplant medicine, the understanding of immunology and rejection. Lastly, I have 5 commandments that I would like to share with some of my surgical colleagues. Humility is an ornament, wear it well. Uphold the art and the science of surgery, for they are a precious gift. Be a team player, be a lifetime learner, innovate and improvise with care. Mentor as you have been mentored. These are the few of the lessons that I learned. I consider that natural talent, dedication, and self-teaching are not sufficient to carry one to the height of mastery. Fundamental is your relationship with your teacher, your mentor, and the influence of your school. We stand on the shoulder of giants. I was tutored in my craft by some very incredibly diligent, dedicated, and committed physician teachers. I owe everything to them. I owe my craft, I owe my expertise, my perseverance, and my teaching, and I never forget those patients who willingly surrendered their bodies and bared their souls to my hands. I would end with a picture of Dr. Denton Cooley. I believe that surgery is a perfect blend of both art and science because they are synergistic in creating the perfect weapon, that is the surgeon. I've used a German word here, it's a portmanteau word, it's called Gestalt. So this is my personal reflection on organ transplantation. A sum is larger than its individual parts. Organ transplantation is more than just a medical procedure. It is a complex event that can profoundly affect identity, relationships, and even overall well-being. Thoracic organ transplant melds art, science, and the more complex emotions of not just the caregiver and the patient in the background of profound sorrow. Somebody has to die for you to get an organ. You have to value that organ. That organ is life-saving. The practice of this craft behooves a great deal of sacrifice and comes with cost to your family and your relationships. The upside is they will help you maintain these vital lessons and pass them on to your team and to a generation of physicians who will follow you as they learn to follow in your footsteps. Those lessons will hold them in greater stead when entrusted with the care of the sick, the aged, and the infirm. And lastly, for Dr. Mandke, as the blade of life and the defier of death, he continues to live in every heartbeat of those he saved. Thank you.
Ladies and gentlemen, Dr. Sandeep Attawar requires a standing ovation. That was a wonderful ovation, sir. Thank you for For a few moments. The gentleman, the president for this oration, as you know, is the well-known Dr. Uday Gandhi. He's going to step up in a short while for his remarks on the oration. Before he steps up, I'd like to request Dr. Nitu Mandke. You know her. She is the daughter of Nitu Mandke. She is a consultant pediatric, robotic and laparoscopic surgeon. She's also director at GV Healthcare. She's the chief operating surgeon at Surrey Hospitals and is attached to many of the large hospitals across Mumbai, including, of course, Nilavati, Holy Family Society and Breach Candy. Dr. Nitu.
Thank you. After hearing that amazing, mind-blowing talk from our orator, thank you very much. And so some things keep reverberating. One is we stand on the shoulders of giants. Surgeons always stand on the shoulders of giants. These giants are our anesthesiologists. So today it is my absolute pleasure to introduce Dr. Uday Gandhi, a cardiac anesthesiologist par excellence. He is originally from Nagpur and completed his MBBS and MD there, after which he proceeded to a premier institution, AIIMS, New Delhi, to gain proficiency in cardiac anesthesiology. After which he returned to Mumbai and as a consultant cardiac anesthesiologist at PD Hinduja and Lilavati hospitals, and he has been there till date. He was the founder secretary of the Association of Cardiothoracic Vascular Anesthesiologists, ACTA Mumbai. Under his leadership, ACTA Mumbai bagged best performing branch in academics thrice in the last 5 years, amongst 15 other regional branches. He has been the course coordinator and excellent teacher for the cardiac anesthesia fellowships at Hinduja Hospital since 2018. All of our panelists have been very good teachers. He has had the honor of being a past president of Indian Association of Cardiovascular Thoracic Anesthesia, and he is a renowned faculty and hemodynamic workshop coordinator at many annual IACTA conferences for the last 29 years. He is an invited faculty at Australian and annual American Cardiac Anesthesia SCA meetings for the last 4 years. He has an immense number of publications in national and international cardiac anesthesia journals. We are indeed privileged to welcome Dr. Uday Gandhi to grace this oration.
Thank you, Dr. Jui, for the great introduction. I should start with comment on the oration is just not needed. It is such a fantastic and mesmerizing lecture that you gave. We are just so proud of what you have achieved fast in such short span of time. I just wanted to say that you are still young, so you can still get. So just one or two things maybe about the transplant that in 1962, under which Dr. Nitu Mandke had done his residency, Dr. P.K. Sen has done the first transplant at KEM Hospital, which probably doesn't come in a great deal, but yeah, that time in Bombay at KEM, the first transplant also was done, right? Although of course the results were not very good, but yes, that was an era where we didn't have too many machineries at a disposal, not many drugs for anesthetics, and of course the technology was very old, but yes, it was done here. The hospital that you mentioned in the Cape Town 3 years back, I had the honor of visiting the center, and it's a fabulous center. Whoever is not gone or whoever is going to Cape Town must visit the hospital and see that center. It is for all everyone, open for everyone to see and go through it. It's fabulous. You get a lot of inspiration when you go through all those steps of the first heart transplant done there. My association with Mandke's, Dr. Nitu Mandke and Madam Mandke is long back when I came back from Delhi in 1995. I remember we were working a long time at Hinduja Hospital. And I still remember Dr. Nitu Mandke, he was very joyous, very joyful. So I remember whenever in the morning he used to come, whether it is his patient or not, somebody else's patient, he won't even know there are patients in the morning just, ready to go in the operation theater for some surgery, he used to say, all the best, you are the best, you are best of the hands, don't worry. So, without even knowing the patients or anyone, this was his routine. I used to see him so many times doing that, not only to his patient, but other patients whom he probably doesn't even know. So that was Dr. Mandke. And such a great personality. I remember first when we came back, me and my wife, we first visited the house in Villeparle just to take blessings that I've come here and that we want to, pursue our cardiac training. And of course, I worked with Madam in the operation theater and Sir so many times. And I also remember when he has visited Nagpur, has come to my house. He was such a busy person, but he was there and he had actually come to our house just for 5 minutes also, but yes. So I found very, very fond memories of Dr. Nitu Mandke, and that is how all doctors all should be. He was such a joy to work with in the operation theater and such a respectful person outside for general public. Only thing I wanted to say about the heart transplant is we need a big team. It's not just the doctors, it's the technicians, the nurses, and the general public, the awareness, the people who are in the public life. They also have a very good and a great role to play to make people conscious about donating organs. Even today, despite all the publicity of the organ donations, we still fall so short of organs that a lot of patients who are on the waiting list still just die. Although the technology is improving, we are going towards maybe total artificial heart. There's still time, it's very, very costly. Not everybody can afford it. But it's a big role to play, I'll say, for non-doctors, for people in the public life, so that we make people aware of it. Every one of us here today should decide to pledge to donate our organs, and that probably will be the greatest thing we can do today after a fantastic lecture on the lung transplants. So that much I have to say. Thank you very much again, Madam Mandke, and thank you very much, everyone here.
Thank you, Dr. May I request you please take your seat at the dais, sir. That was our president of the oration, Dr. Gandhi. I'd like to request all the personalities to please take their seats at the dais. Our orator, Dr. Attawar, our special guest, Mr. Ronalani, Dr. Gandhi, the president, Dr. Gimchitala, Dr. Alkamandi, Dr. Suresh Rao. Ladies and gentlemen, this oration always comes with a memento and a citation. And before we present the memento, I'd like to request Aroria, who's been a long time personal assistant to Dr. Nitu Mandke, to please do us the honor, step up forward, and to read the citation before the citation and memento is handed over to our orator. Our orator is on a very tight schedule, and I'm afraid that we already stretched that schedule to the limit. But we thank you for being with us here, ladies and gentlemen, and taking time off from that very tight schedule to share with us his passion for the art and science of surgery. I'd like you all, please give a big round of applause one more time. It's been a fantastic oration. And now, over to you.
Dr. Nitu Mandke Oration Committee. Dr. Nitu Mandke has a vision, a beautiful dream of the future of healthcare for our country and its people. Today we pay tribute to him for his lifelong services to the society. We bestow upon Dr. Sandeep Attawar for his achievements and contributions to the field of thoracic transplant the honor of delivering 23rd Dr. Nitu Mandke Oration, signed by Dr. Jamshed Dalal and co-coordinator, and Dr. Alka Mandke, chairperson.
Wonderful. I'd like to request Dr. Suresh to hand over the citation. I'd like to request Farhad to please get the memento across to Dr. Alka Mandke. now the memento that comes along with the citation. This year, the 53rd Dr. Nitu Mandke Memorial Oration. Dr. Sandeep Attawar. Legend, you were watching the presentation of memento with so much rapt attention as much as you were listening to the presentation by Orator. So once again, we'd like to thank our Orator, and this time again with a loud round of applause to please the and the entire group we wish him well in his journeys. With that being said, ladies and gentlemen, it's now time to continue with the program, but I do understand that Dr. Attawar has to leave. Or would you be waiting with us for a little while, sir? We do have, yes, a little memento. I don't know if you can take that with you, but there's always a living memory to give away. There is a little plant here. And for our audience to please get the plant across, so that plant can also be given. Somewhere. So, Dr. Attawar, this is something to take back to memory. Maybe if you plant it somewhere years later, you will see a victory and remember.
Thank you, everybody. I'll just take a brief moment. There's something I forgot, and I think it's, I mentioned to Mandar that I would mention this during the speech. I think I got a little emotional towards the end of it. But in 1996, I was a first year MCH student in Sri Chitra Tirunal. Madam Alka Mandke and Dr. Nitu Mandke had visited our center. They were supposed to demonstrate minimal access coronary artery bypass graft, left internal mammary to LAD. So you have to understand the background of it. We were a training institute. We used to perform all kinds of complex procedures on, and Dr. Suresh Rao preceded me, he'll know more than I do, with an incredible amount of assistance and support, not just from the Ministry of Health and Family Welfare, but also from the Department of Science. It was a training institute of an incredible factory that manufactured and brought out some of the best surgeons in the country today. But what was most important is this was a novel procedure. And what made it even more novel was he was doing it through a probably 2-inch incision. He did not have a cardiac stabilizer. There was no cardiac stabilizer in that day. We use all kinds of... Yes. He had something that he had thought about, he had made of his own, but still that heart kept moving. And it was an incredible dance between the anesthetist and the surgeon. Because every time ma'am would give a small dose of a drug, he would wait for the heart to pause for a second and he would take a stitch. That was his skill. And that was his anticipation. And this lady there, she made it happen. And he did it with such poise. He was almost a super rock star in that room. You know, for all of us young surgeons, the amount of inspiration that I got that day from him was simply unbearable and unbeatable, incomparable. I cannot describe it. But I am so deeply grateful, and this is my connection with Dr. Mandke, just 1.5 days. And he actually ignited that fire in me, which probably he's lighted it forever. So thank you, madam, once again.
Thank you, Dr. Attawar. We shall now proceed with the screening of the Dr. Nitu Mandke film, as we always do. May I request Dr. Attawar and the people of the panel to please join us in the audience. And Dr. Attawar, if you can wait. Good. But we do understand that you have a very interesting schedule. Family photograph, please. Can we have family members for the photograph? Manar is always missing. Do we get him finally? He's disappeared. He's just started another marathon, or he's disappeared. So Thank you, ladies and gentlemen. You take your seats in the audience, and we shall roll the film.
The reason why Dr. Attawar is leaving is he's got a emergency lung transplant in Hyderabad. Otherwise, he would have stayed with us to the end. So we wish him good luck for his heart transplant and hope the patient does very well, which I'm sure he will.
Once again, ladies and big round of applause. It's been a very enthralling presentation. I must say that we really enjoyed it. To all of us, the passion that Dr. Attawar has shines through. And as he said, it was an emotional moment at the end, not only for him, but I guess for all of you too. So please give him the applause that he deserves as he leaves. Good memories to take away. Thank you so for being with us here, making it so very special. And as always, we all wish you all the very best.
I'd like to just take a moment. This gentleman had a double lung transplant 4 years ago. He can probably tell you more. So my only request to all of you was that this is something that most of you have probably not heard of. And I think unfortunately in our experience we've noticed that Maharashtra especially and Bombay at large has probably some of the most prolific incidences of hypersensitivity pneumonitis, which is brought about by pigeon poop. It's unfortunately unavoidable in many of our circumstances. Many youngsters and middle-aged individuals are affected by this disease. It only leads to terminal lung failure. My only request today is, as a social message, please try to encourage your surroundings, your audience, to try to desist from treating those animals as messengers of God. They are silently preying on each one of you and your children and the future. So that's my only message. But thank you once again.
Thank you so much again.
Yes.
Yeah.
Wonderful talk. Thank you.
So one more.
Thank you. Thank you.
And now for most of us, I think after hearing the message, the song is going to be Gurudhar Ja, Ja, Ja.
Request everybody to be seated. We are going to continue the rest of the program. We had to change it a little bit because Dr. Attawar had a surgery, a transplant surgery in the evening, so he had to head back to Hyderabad. We are going to continue by starting the film on Dr. Mandke as is customary.
Later, while in Pune, Ashok joined Bhavi School in 1956. Vasudeva Bandhwate had founded the school. Ashok's extraordinary sense of patriotism and national pride stems from his tenure at the Bhavi School under the guidance of some of the highly respected teachers of that time. Ashok was selected to attend varied institutions to inculcate values of patriotism and Indian culture during the post-independence era. Along with gaining proficiency in drawing, he also excelled on the sports field. He was a smasher in football, says his classmate, Jayant Tatle. He was similarly proficient in athletics, boxing and volleyball. Anil, his elder brother, contributed largely to the upkeep of the family from a very early age. This sense of sacrifice runs deep in the Mandke family, which has been passed down from generation to generation. It was his early military training in Maharashtra Mandir that was responsible for his disciplinary approach. Ashok's college education took place in Maharashtra Education Society, one of the premier, yet economical institutions in Pune at that time. Ashok believed in and practiced meditation right from an early age. His guru, Maharshi Nyayaratna Appa Sahib Vinod, was a great philosopher. He changed Ashok's name to Nityanath. Later, Nitu sought out and paid his profound respects to many spiritual personalities from all parts of the country. From a family full of engineers and mathematicians, Nitu was the first to choose a medical career. He was awarded a merit scholarship to study medicine at the esteemed BJ Medical College and Sassoon Hospitals, Pune. This is where he met his classmate, Alka, his lifetime companion at home and in the operation theatre. After completing his MBBS from Pune in 1970, Dr. Mandke came to Mumbai so that he could specialize in cardiac surgery.
I found him very smart, very intelligent and artistic.
Very skillful with the hand.
When he was a lecturer at one time, I remember, he had operated a very complicated congenital heart disease. The registrar called me that the patient is bleeding and please come down. So I said, but where is Mandke? He is a lecturer. Have you sent for him? He said, yes, I have sent for him, but he has not turned up. Which was quite kind of funny because I never had Dr. Mandke not respond to the call very quickly. So by the time I went from Grant Road to KEM Hospital, I saw Mandke come. So I said, Mandke, what the hell is happening? I come from Grant Road and you were in the quarters, you have not come. So immediately he showed me 2 bottles of blood in his hand. So I said, what happened? He said, I know this patient is A positive, I am A positive. I also knew that there is no blood in the operation theatre. So he went to the blood bank. As soon as he got the call, he went to the blood bank, bled himself 2 units of blood for the patient whom he had nothing to do. And he got it cross-matched, so obviously he got delayed.
This man, with all the difficulties a man would face, coming from a village to Pune, taking primary education in Pune, then coming to Bombay, learning the primary surgery, then going abroad, working in London with one of the greatest heart surgeons, Sir Maddi Yakub, then going to America, working with another pioneer, Dr. John Kirkland and Pacifico. I mean, very few people can do this in their lifetime.
He has struggled in his life. He has then achieved whatever he has today.
After working in these countries for 8 years, Dr. Mandke chose to return to his country.
He could perform adult surgery and congenital surgery with the same ease.
इंग्लंड अमेरिकेमधल्या पेशंट्सच्या ज्या रक्तवाहिन्या असतात त्या मानाने आणखीनच लहान असतात आणि त्यामुळं इंडियन पेशंट्समध्ये भारतीय पेशंट्समध्ये ही सर्जरी करणं हे खरं सांगायचं म्हणजे जास्त कठीण आहे.
अक्षर इतका सुंदर होता की त्यांनी लिहिलेल्या नोट्स म्हणजे अगदी परफेक्ट असायच्या.
And he was a born artist. I used to admire his drawings.
Drawings he used to make after the patient's surgery was over. It was so self-explanatory.
It was just fantastic.
It was more exciting than a Hollywood movie.
He has got a wonderful hand. Some magic is there. During his increasingly successful professional and public career, he came across people from all walks of life. He was especially gifted to interact with all of them with ease. He was publicly felicitated by many organizations in recognition of his excellence in cardiac surgery as well as service to society. Recognizing the need of basic medical facilities to the deprived, Dr. Mandke regularly conducted medical camps in many underprivileged areas of India. Many patients in the slums of Mumbai city have benefited from Dr. Mandke's free medical camps. At remote areas like Hemalkasa and Anandvan, Dr. Nitu Mandke donates basic medicines and medical accessories every year. These medicines are distributed free of cost to the extremely poor tribals. Out of the 12,000 successful cardiac surgeries Dr. Mandke has conducted so far, 4,000 have been absolutely free of charge.
He wanted to bring down the cost of surgery for common people.
माझ्या जवळजवळ 30% पेशंट्स मी माझ्या दृष्टीने फ्री करतो.
And that's why he was very, very kind to his patients. He was one of the few doctors who treated his patients totally free of cost.
आपण कोणी स्कूल टीचर आला, कोणी नर्सेसचे वडील आले, कोणी वॉर्ड बॉयचे कोणी मुलगी आली, आम्ही कितीतरी ऑपरेशन्स करतो. लोकांच्या मनामध्ये एक गैरसमजूत आहे की बाबा मांडके भयंकर महागडा माणूस आहे.
डॉक्टर साहब का हमें भी मिरेकल जैसे ही है. And I'm very proud to have a doctor like Dr. Mandke.
Mandke was a person who believed that everyone should get the best possible treatment. And not only medical treatment, but treatment as a human being.
ती 2 महिन्याची गरीब मुलीचं ऑपरेशन फुकट केलं हे कोणी सांगत नाही.
He has made richer patients do charity through him.
10 लाख लोकांना जेव्हा परमेश्वर जन्म देतो त्यावेळेला त्यांची चिंता होण्यासाठी, काळजी करण्यासाठी एका प्रेषिताला जन्म देतो. पण डॉक्टर ही व्यक्ती नव्हती. डॉक्टर एक प्रेषित होते.
आज माझ्या बाबतीत जे ऑपरेशन झालं त्यानंतर आता पहिल्यापेक्षा जोमाने मी कीर्तन करतोय.
असे शल्य विशारद जे आहेत असे मला वाटतं फार फार थोडे आहेत.
He conducted the first workshop in minimally invasive coronary artery surgery, or MICAS, in 1995 at PD Hinduja Hospital. He believed MICAS would tremendously reduce the cost of cardiac surgery.
Well, MICAS is a surgery he was one of the first ones to do in this country.
Thereafter, he was invited for national and international conferences to share his experiences. He also conducted various workshops in India and abroad to educate other surgeons.
जो आदमी की कोई कीमत होनी चाहिए उसकी कीमत ही नहीं होती, और जिसकी कोई कीमत नहीं है वो बहुत बड़े स्थान पे जाके बैठता है. Is that a democracy? Do you call it justice? And if that person wants to go abroad and study, why you blame him? And if he doesn't want to come back in this country, why you blame it? You want to change. Now you want to change it, and the government has to change it. So you change the damn government. This is what is important. Now you clap.
It's like the jackfruit. Very crude, rude, spiky from outside, but smooth, very, very gentle and extremely sweet from inside. सर फटका माणूस होता.
फटका कुठे तुला वाटते का मी फटका पडा? मी सत्य बोललो लोकांना वाईट वाटतं, त्याला मी काय करणार?
भाषा त्याची अतिशय शिवराळ होती मात्र त्यामुळे आमचं जास्त जमायचं.
His ability to convince his patients that they need to undergo surgery.
The minute a patient used to enter his clinic, they say, okay, that's going to be my surgeon.
And they would go in and they would come out and I would see like them smiling from ear to ear.
Oh, very colorful man. And you see the way he wore his clothes, his style of speaking.
Of leadership, team spirit, hard work, dedication, and his flamboyant style were par excellence.
Oh, he was a very charming personality.
Whenever we had parties and he was there, you could rest assured that the party would be full of fun and laughter. He always knew how to get along with people, to rope in everybody. He was
shy.
Since we are talking about man of charisma.
The whole room would come alive when Dr. Mandke would enter the operating room.
Every time that he came and he would just pat you on the back and just walk off, you know.
वो एक बहुत सुंदर छोकरी इधर उधर से जाती दिखती है तभी स्ट्रेस होता है.
This is the way I like to live. I like to enjoy my life. He was a common man. तो स्वतः नेहमी जमिनीवर राहून स्वप्न मात्र त्याने आकाशावर बघितली.
एक गोष्ट डोक्यात घेतली की त्याच्या मागे संपूर्णपणे हात धुवून लागायचा आणि आपलं संपूर्ण जीव त्याच्यात होतायचं.
थेट नजरेत बघण्याची त्याची जी पद्धत होती ती इकडे तिकडे नजर टाळून कधी कोणाशी बोललाच नाही हा माणूस.
क्वचितच जगामध्ये असे सभ्यताची लोक येतात आणि आपल्या तेजाने ते सगळ्यांना तेजवून टाकतात. नीतू हा धूमकेतू सारखा होता.
कौशल्य ज्यांच्यात आहे ते योगीच होते.
Just writing behind the truck or viewer tempo, मेरा भारत महान, उससे भारत महान नहीं होता. You have to change.
His ideas were always big, and this is why when he embarked on his Mandke Hospital, the Mandke Heart Hospital, he didn't want it to be the second best. He wanted it to be the best. Best in India, best in Asia, probably the best in the world.
His transition from a heart surgeon to a promoter, developer and a conceiver of a hospital was so easy.
Civil engineering was child's play for him. I said that I should contribute to that endeavor in terms of how information technology can contribute to building the modern world-class hospitals of tomorrow.
मी काय बीच हाऊसेस बांधू, फार्म हाऊसेस बांधू, मी काय मी हॉस्पिटल बांधू शकतो. परंतु तेवढा पैसा डॉक्टरकडे नसतो, तो इंडस्ट्रियल हाऊसकडे असतो. म्हणून कोणी डॉक्टर हे बांधायला दजवत नाही. आता मी कसं बांधतोय हे माझं मलाच माहिती.
A dream that began more than 30 years ago is now about to take shape. The Mandke Heart Hospital and Medical Research Center has 17 floors, 550 beds, 14 operating theaters, and every conceivable state-of-the-art medical technology dedicated entirely to the well-being of your heart.
He was ambitious. And he took a challenge which nobody can ever even imagine in a dream.
Barker was the architects of New India.
जे लोक स्वप्न बघतात ते स्वप्न साकार कसं करायचं हे सुद्धा त्यांना माहित असतं.
But it never came. Heart attack came.
The 14 operation theaters will not only have the best medical equipment, but also have the most skilled and efficient doctors and support staff in the country.
ते एवढा एक डॉक्टर एवढं बांधू शकतोय, ते स्वप्न तो साकार करू शकतो म्हणून छाती धडकते लोक.
Larger lobbies, cafeterias for the guests and relations for the patients, a small shopping complex, banking service, travel agency to help the patients to make their travel arrangements, telecommunication center, playroom for the children, a temple and a meditation room would be the exclusive features of this hospital.
For the first time in India, an air ambulance will be used to airlift critical patients from anywhere in the city and its surroundings and transport them directly to a specially constructed helipad on the roof of the hospital, thereby facilitating instant medical help.
It's a completely baseless accusation on him if they are saying that he wanted to design something for the rich.
मी तर गरीब माणसाला सुद्धा 5-star ट्रीटमेंट द्यायला निघालोय.
Dr. Nitu Mandke's dream can never die. Dr. Alka Mandke, who has witnessed each and every milestone alongside Dr. Nitu Mandke, is fully committed to ensure that this dream becomes a reality.
He wanted India to have the best. I mean, he was somebody who took great pride in being in India.
I love this place. That's why I want to see it improve. I want your children, everybody get a proper education.
we watch that film every year, and every year it's always fresh, and always something to take away from that film, no matter how many times you watch it. Like the film gives us some points to think about, we also have over the years the journey of the memorial oration, which has some very interesting top points. And to tell you about that is a lady who's been involved with it right since its inception. She is Dr. Nitu Mandke. She's head and at the Department of Professor and head of Department of Ophthalmology at the Hospital, and of course Dr. Hospital. There's a few for me to stop talking, but I'll just say that she has inherited her parents' love for the less privileged. She's part of an NGO that looks after rural India, improving healthcare, Community Science Alliance, and she's also director of a couple of NGOs. For you, ladies and gentlemen, Dr. Nitu Mandke.
Good evening, everybody. I was unprepared for the amazing talk that was coming today because, a lung transplant surgeon coming from the arts and architecture, and, it reminded me of my father because he was an artist, and his, we could not live up to that level of art as much as we tried, and he expected us to be equally good artists, meticulous, perfect in everything that we did, know where the ruler is at home, know where the eraser is, use the right thing for the right time, and it should all be available, and we should know where everything is. And we had to have excellent handwriting, otherwise our papers would be torn and we would be stared at, and then we would have tears. So it just brought it back to me how much he also believed that everything has to be done perfectly, and how art is so close to surgery. And I think one of the reasons why Zui and I both decided to be surgeons. So we had excellent orators over the years, and I will go through it quickly. In 2004, we had our first oration here after the hospital was commissioned. And it is Dr. V.S. Subramaniam from Lenox Hill Hospital, then Padma Shri Dr. Valiyathan from Manipal, and Padma Shri Dr. K.M. Cherian from Chennai. Then we had Dr. K.R. Balakrishnan from Chennai, and then Padma Shri Dr. Ashwin B. Mehta, Director of Cardiology, Mumbai, Dr. Naveen C. Nanda from the US, Dr. Deepak Tempe from Delhi, Dr. Mukesh Hariawala, Mumbai, Dr. K. Srinath Reddy from New Delhi, Dr. Suresh Rao, our very own, from Kokilaben, and Dr. Sudhanshu Bhattacharya, again from Mumbai. In 2015, we had Dr. Naresh Trehan, Dr. Devi Shetty in 2016, and Dr. Bharat Darvi in 2017. Following that, in 2018, we had Dr. Krishna Iyer from New Delhi, and then our Dr. Jamshed Dalal from Kokilaben, and Dr. Shiresh Sheramat from Pune. In 2021, we had Dr. P.S. Reddy, Pittsburgh, USA. 2022 was Dr. Michael Reardon. It was online, and because of COVID, Dr. Anvay Murray, who's here today in 2023. In 2024, Dr. Samin Sharma. And then last year, we had Dr. Prasad Rajhans from Pune. As you can see, a wide variety of innovators and people top of their fields were able to give scientific as well as lucid orations to medicos and non-medicos alike. And I consider ourselves very lucky to have this lovely audience continuously every year for so many years. Thank you very much.
Thank you, Dr. Teresa. It's now time to welcome our panel back onto the stage. Please welcome this orations panel onto the stage. Our President of this oration, Dr. Uday Nande. Our special guest, Dr. Zulnar Kulkarni. Our principal guest of this oration. Thank you for stepping up, sir. And of course, Dr. Dalal and Dr. Mandke to please grace the desk. And now, ladies and gentlemen, we've been hearing people people from the profession talk about their passion for the profession and how the art comes into the profession. And now it's time to hear from somebody who is passionate about art to talk to us. But before we do that, I'd like to request Dr. Alka Mandke to please step up to the podium and give a filling welcome to our very special guest, after which we will request our special guest to please address us. Thank you.
What a fantastic oration we had. Everybody was so happy to listen to him, his thoughts, and the presentation itself was phenomenal. I think every oration we feel that this is the best. And so again, today we feel that this is the best. I don't know who is going to get next. I thought of calling artists today because an artist is operated and he is here. So can you please stand up, both of you? So both of you. He is Vidyadhar Joshi, and I did not know the lung transplants have been so successful in Mumbai and elsewhere. And I happened to listen to his interview on YouTube. And then I found out about Dr. Attawar. I always call him Dattawar, I don't know whether. But Dr. Attawar. And then I was pleasantly surprised that so many transplants he has done. And he is such a humble person, and that everybody else has experienced today. So I thought, because of that, we will have a chance of getting artists today as guests. So Mrunal's name came to me because she is my favorite artist. I met Mrunal first when my sister-in-law, IAS Neela Mandke Satyanarayan, decided to make an audio cassette, Hunkare Re Rudhayatala, of selected poems written by many of Dr. Mandke's lovers after he suddenly passed away. I saw her as a most beautiful, sweet, talented, smart, yet soft-spoken and simple person with her very impressive style of attire and makeup. Mrinal is a highly educated lady and has been acting or directing select Hindi, Marathi movies and now English movies and dramas. With her rich experience, Mrinal has received many accolades and awards, but along with that, she does a lot of social work too, being much more than an entertainer. Her son Virajat is also actor, director, and his stage drama has broken all records. He also has acted in movies and popular drama. Recently, he directed and acted in Varvar Se Vadhuvar, was a hit. Their latest play together, Ko Hum, at prestigious Grand Nita Mukesh Ambani Cultural Center, which I witnessed with my brother and niece, Vibha Padarkar. It was houseful and applauded by all. We really loved that performance. Just to give you a few examples, Mrinal shot to fame and became household name after her first television serial, Swami, and never looked back. She acted in choicest films and dramas like Dr. Babasaheb Ambedkar, Veer Savarkar, Pawan Khind, Sher Shivaji, Gosht Eka Paithanichi. It's a variety of subjects, but it is always with a very good motive and something to learn about. She is known for her roles in more than 22 successful TV shows like Avantika, Raja Shiva Chhatrapati, and more. She has recently found success in her foray into the world of direction. Prem Manje Prem Asta, the first movie written and directed by her, won many awards. So did her second, Ram Madhav, a historical saga. The grand period piece, Ram Madhav, her third film as a director, Ti Ani Ti, and she already is working on her next one. I don't know how many she will come up by. Mrinal has also been one of the most successful models and the brand ambassador for a wide range of products. Carrying forward the legacy of her grandfather, I must mention the former literator, Goni Dandekar. She is associated with all the leading newspapers, and she has also penned a book, Makeup Utravlyavar. Makeup Utravlyavar. So, such an interesting topic, which is currently on its 9th edition. She has won over 100 awards and accolades for her work, including V. Shantaram Vishesh Yogdan Award, Gonida Puraskar, Lokmat Maharashtrian of the Year, to name just a few. She has been a jury for Oscars, national awards. She also is the member board of founders Planet Marathi, the only Marathi web channel. It will go on and on, but now we are keen to listen to what she wants to say. Thank you very much.
Our special guest at this 23rd Dr. Nitu Mandke Oration, Ms. Brenda Kulkarni. For yours, ma'am.
Now you know how much she loves me. Honorable Dais, respected audience, ladies and gentlemen. Well, I was thinking, why is she calling me to this program? And why as a guest, and why am I not sitting there and listening like all of you? तो अभी पता चला कि क्या राज है उसके पीछे. I read a very classic joke about a heart surgeon. I think थोड़ा सा light कर देते हैं सब चीज़ को. A mechanic was working on a Harley engine when he saw a famous heart surgeon waiting in the shop. He was waiting for a long, long time. The mechanic asked the surgeon a question comparing their work. So, doc, look at this engine. I can open it up, take valves out, fix them, put it in new parts, and when I finish, this will work just like a new one. So how come I get chiller and you get a lot of money? We are doing basically the same job. The surgeon smiled. He leaned in and said, try doing it while it's running. Today, all of us, we are here to remember and honor a man whose life became a heartbeat for thousands. Dr. Nitu Mandke, a name spoken with a lot of respect, gratitude and admiration in the world of medicine. And let me tell you, I come from a city, we share the city. I haven't met Dr. Nitu Mandke ever, but I heard so much about him. And in spite of being a Punaite, I must tell you, in Pune, very few people talk highly about other people, but Nitu Mandke, Dr. Nitu Mandke is one name we are really, really so proud of, and we fondly remember him all the time. Dr. Mandke was not merely a cardiac surgeon, he was a guardian of life, a man who stood between despair and hope, between a falling heart and renewed breath. With extraordinary skill, unmatched speed, and unwavering confidence, he performed thousands of heart surgeries, restoring life where fear once lived. What truly set Dr. Mandke apart was not only his brilliance in the operation theatre, but his deep humility. We all watched the docu, and I'm sure all of you must have experienced it. He believed that medical excellence should never be a privilege of the few, rich or poor, powerful or powerless, and for him, every patient was simply a life that mattered. His hands carried precision, but his heart carried compassion. Dr. Mandke dreamt beyond personal success. His vision was to create world-class cardiac care in India, accessible to all, and we are today accumulated here. We are here assembled to talk about him in the same building. I'm very happy about it. Though his life was tragically short, his dream laid the foundation for what later became one of India's most advanced medical institution. This is the work of a true visionary, someone whose work continues long after they are gone. He lived intensely, worked relentlessly, and gave selflessly. In doing so, Dr. Nitu Mandke proved that a doctor's greatest achievement is not fame or fortune, but the silent gratitude of lives saved and families restored. Today, as we salute him, let us remember that his legacy is not confined to buildings or statistics. It lives on in every heartbeat he helped protect, and in every young doctor inspired by his courage, discipline, and compassion. Dr. Nitu Mandke may no longer be with us in body, but his spirit continues to pulse through the very heart of Indian medicine. And today we are celebrating his 23rd oration, and I must congratulate Mandke family, because to carry on the legacy, to make people remind how great a person he was is not easy to do for 23 years, and she's been relentlessly doing that. I said I had no opportunity to meet Dr. Nitu Mandke, but I met Mrs. Alka Mandke several times, and the way she talks to people, the way she helps people, the way she conducts herself is a big example in front of me. So I really look up to her, and I wish the entire family a lot of success, a lot of solitude, and a happy life. From next year, I'm sure I'm going to sit there when Dr. Attawar, he started speaking. I was much relieved because I knew nothing about what was going on here and the subject and all, but he said the word art about 100 times, and I was relieved. And beautifully he correlated art and surgery, and what a great orator he is, and what great examples. He told us history and entertained us, though he was speaking on a very difficult subject. So this function every year in itself is an epitome, and I am sure as all of you enjoy coming here every year, from next year I'll sit in the audience with you all and enjoy all the lectures henceforward.
Amen. And with this oration, this very special suggestions.
Yeah, thank you very much. Thank you for calling me. Keep loving me as you always have. Thank you very much.
Yeah, thank you. I want to say we have a special guest with very special gravitas. Thank you, ma'am, for making it, unique today. And of course, your presence will always be wanted here every time there's an oration. Today, we also like to thank, after this, the person will be stepping forward to deliver an address to us as our principal and chief guest. Thank you for stepping up, sir. And to do us the honor, it's my pleasure once again to welcome a gentleman who will introduce him. This gentleman is singularly a triple doctorate in medicine and cardiology from Mumbai, and of course a PhD from the UK. He's also been a past orator. You must have seen his name and photograph right here. And of course, he started everything for us today. Ladies and gentlemen, please welcome Dr. Dalal to step forward and introduce our chief.
It's a great pleasure for me to introduce Dr. Suresh Rao, my colleague and the director of pediatric cardiac surgery. It's interesting to hear from him, because if I were to ask today anybody about heart surgery, they would invariably talk about bypass surgery, valve surgery. Nobody really thinks of pediatric cardiac surgery, something which just doesn't come to mind. But there are a lot of children, newborns, young adults who have congenital heart disease and who need surgery. If you look back when I started my career in cardiology, most of these babies born with congenital heart disease would invariably die. You see these babies dying in front of our eyes, we refer them to the surgeon, and the surgeon would say the baby is too small to operate, let the baby grow and we'll be able to operate. But the babies never grew, they died. It's people like Dr. Suresh Rao who have changed all this. Surgery is being done in newborns, even in vitro surgery, but newborn surgeries where you can imagine the baby's size. I want you to, for 1 minute, think of a strawberry. Strawberry is red like the heart. It's the size and shape of a heart, and the sizes of a newborn baby. And imagine trying to operate on that strawberry and get the baby alive and well. And that's what Dr. Suresh Rao does. Dr. Suresh Rao.
Good evening, all of you, and Dr. Dalal, thank you for the trifle embarrassingly introduction. It's my privilege I'm an in-house person here, and I would like to share an anecdote of Dr. Mandke. Before I joined Kokilaben Hospital, Dr. Mandke visited Cochin, where I was working in the Amrita Institute of Medical Sciences, and he had come to attend a surgeon's meeting. And I was told in my office that there is one surgeon from Mumbai who wants to come and see the campus. I said I was overjoyed because I studied and had my education in Mumbai, so anyone coming from Mumbai was very interesting to me. So here he walks in, and we all knew of Dr. Mandke, of course. I mean, and being in the cardiac surgery arena, he needed no introduction. And to my very, very pleasant surprise, here Dr. Mandke walks into my office, and they are trying to introduce me to him. So I showed him around our department, our operating room, ICU, and all that. Then we sat down in my office for a cup of tea. He asked me, "Where did you do your MBBS?" I said, "JJ." "Where did you do your MS?" I said, "JJ." Then MCH? I said, "Chitra." That's where Dr. Attawar also, I'm a little few years senior to him. So then he looked up and he said, "Tu ikde kai kartos?" You should be coming back to Mumbai. Have you heard that I'm starting a hospital? I said, "Yes, sir, we know you're starting a hospital." But then, it's fate had that I start the unit here. But those were prophetic words. And 2003, I think he passed away, ma'am, if I'm not mistaken. 6 years later, I get the offer from this hospital to come and start here. So it was sort of a very, very coincidence, a pleasant coincidence that in his hospital, I had to come and start this department. So with these few words, and we have heard in spellbinding oration by Dr. Attawar, Sandeep Attawar, who's a very close friend of mine, and we being the same alma mater of Sri Chitra Institute in Trivandrum. Many points what he was saying was sort of the things which went on in my mind at some stage in my training. My mentor was Dr. K.M. Cherian, who was one of the earlier orators here, and I worked with him for close to about 11 to 12 years, and that's where I learned pediatric cardiac surgery. And when we were young, and we used to make errors, and sometimes we used to lose children because of the errors, he would come and say that any monkey can become a surgeon, but it takes a long time to become a safe cardiac surgeon. So this is what I keep telling my juniors, that anyone can become a surgeon, but it takes that many years of working with a mentor in a unit, introspection, to become a safe cardiac surgeon. The other thing in surgery is I always get compliments from my patients about your hands. Yes, hands are required for surgery, but it takes a long time for the hands to get connected to the brain. We all read theory, we all read books, we all read literature, but to translate that into action and into successful action, that is where I think we undergo training, we go mentorship, we make errors, we feel depressed, you rise up again, and that is how all these are built. So to to extrapolate whatever Dr. Attawar mentioned. At no time I can take the credit. It's always the credit standing on the shoulders of my mentors. And humility, introspection, and realizing of the fact that we are only mechanics. We are not the creators. I think if that we can remember, that is enough to further this specialty. Thank you so much.
Thank you, Dr. Suresh. Ladies and gentlemen, all that remains us to thank all the members of the panel for being here with us. Of course, we had a fantastic oration, but the members of the panel also added that much glitter, glamour, and information to our day. So without further ado, I'd like to request the family members of the Mandke family, and if Alodia is here, would you please pick up one of those wonderful pots and hand it over to Dr. Mandke. The first one, of course, we'd like to honor our special guest, Mrs. Brunal Kulkarni. Maybe you request the panel. Dr. Mandke, Dr. Dalal, would you please present this one to Brunal Kulkarni? Is Ara in the hall? The next one is for Udayanand. Very special thanks coming for Dr. Suresh Rao. Thank you once again, sir. Dr. Suresh Rao. And last but not least, Dr. Dalal. Thank you once again, sir. There's also a very interesting book to take away, as someone was talking about. More from less or more. That's okay, we can always say all this. You may please request a minute photograph of the entire panel again. May I request the panel to please be seated for a minute or two? Thank you. And now, ladies and gentlemen, we've had a fantastic day today, a great oration, a great talk by a special guest, a little sharing by a chief guest, and of course, it has been luminaries on days. To bring it all together, I'd like to invite a man who is truly a marathon man. You know how marathons are, they start slowly, but they end very strong. This gentleman truly in his life has said just about everything in he's a great scuba diver. I forgot to tell you, he's an MBA in finance, he's an engineer, robotic engineer by profession, or at least that's what he studied for. And then he took up diving. He's also into, curating experiences for young children, making them watch the skies at night. Also building peaceful farmhouses, gated communities, camping sites, and running a marathon. The last he did was run a marathon, so bring this to an end, please welcome Orator.
Thank you. I have a lot to be thankful for. I'll start with you, Alaric. Thank you for the wonderful introduction and always being there as a voice and guiding this whole event. a special thanks to Dr. Sandeep Attawar, who delivered a wonderful oration that even non-medicos like me or most of us actually were engaged with. I would like to thank our chief guest, Dr. Suresh Rao, for stepping in last minute, and our special guest, Mrunal Kulkarni, for a wonderful address. Also Dr. Uday Gandhe, Dr. Dalal, the Oration Advisory Committee members, Dr. Anvay Mule, Sir Dr. Arun Chaukar, who we saw on the video as well. It's an honor to have you here. Also a special mention to Dr. Natarajan Padma Shri for being present here for this oration. Also, thank you, Mr. Vidyadhar Joshi, for making it is an honor to meet the patient of the orator in the audience. This event cannot be possible without two people, Alodia and Farah, who are the engine behind this whole machine. And of course the steering wheel, like I mentioned, Alaric, and many thanks. I mean, it's a little odd thanking your own mother, but for being the driving force and conducting this year on year, and ordering us to tasks and making sure we are challenged in that aspect. I would also like to thank the KDH team, starting from the chairman, Mrs. Tina Ambani, Dr. Shetty, also the admin team, the entire Dr. Nitu Mandke Convention Center team for conducting or for allowing us to conduct it in such a seamless manner. For the technical help, Mr. Satyen and Santosh. And well, most of all also for the high tea that is arranged outside for all of us after such a long and interesting event. I would like to thank Nazfar and Sonal Modi for arranging the high tea outside. There is also, it's also such a wonderful thing that it's Baba's, it's Baba's birthday. He would have been 78 today. And we have a cake, which I hope you all enjoy outside with tea and coffee. I would like to thank Mahendra Maru, as always. For the last 23 years, he has been responsible for decoration that you see down next to the statue, for the beautiful decoration. Without even mentioning it, it just magically appears. Also, for the past 23 years, there's been Trends that has been our media support. And this year we also did live streaming in telecast. So thank you, Sandeep and the Trends team. And finally, and lastly but not least, all of you who are always here and in this number to witness this, to meet us all. It's always a great pleasure. Thank you all very much.
Thank you. That was wonderful indeed. And now, ladies and gentlemen, as Mama has said, there's a sumptuous high tea waiting for all of us. So on behalf of the Mandke family and the Mandke Foundation, thank you, ladies and gentlemen. You once again made a very memorable memorial oration. Thank you. There are few photographs to be done, so I'd like to request that if you need a photograph to be done, please.
तुला देतो कुछ मैं पीछे आता हूँ पीछे पसंद है चलो साइड से देते कर रहा हूँ मैं